for the introduction. So let me share my screen. Okay, can you see the slides? Yep.
Yes.
Okay, great. Thanks. So I'm Hadi. Right now, I'm a senior research fellow in Cancer Health Service Research Center group at University of Melbourne. So I'm going to talk about simulation modeling in health technology assessment. Okay, let's start it. So the overview of my presentation is talking a little about what is simulation, what are dynamic simulation modeling are, and why we need them, and introduce some of them. And then specifically, I will talk about system dynamics, one of the simulation modeling, dynamic simulation modeling, and introduce it with more detail with some examples and cases. So in HTA or health technology assessment, there is a debate, there is an ongoing debate about is the traditional techniques are enough for healthcare decision making or doing analyzes different scenarios in healthcare system or not, especially comes to complex systems and complex decision makings. So in one spectrum, some believe that yes, still the traditional one are enough, something like clinical trial evidence, cost-effective analysis, and also state transition models with limited number of health status, which is quite happening in some techniques like Markov decision process. But on the other hand, on the other side of the spectrum, people believe that we need more, we need something else, because we are now dealing with precision medicine technologies. We need to make the decision making in health system at the individual level. There are more complexity, and we have to handle specific needs of patients based on their characteristics in their diagnosis and their treatment. So, so that people believe that we need some more advanced techniques like dynamic simulation modeling. So again, what is this DSM, dynamic simulation modeling? These are actually developed using mathematical formulation to capture or simulate the processes happening in a system. That could be a healthcare system. It's not necessarily used in healthcare system. It's been used in many different systems like manufacturing systems, services, and many others. And they are going to investigate different scenarios or interventions beforehand or before applying them. So you try to simulate the system artificially, and then try to check different scenarios beforehand. You applied any of those scenarios, and then find the best decision and go with the optimal decision or best decision. So, and they can provide informed decisions or informed data for managers or policy makers to do their decision making or develop their strategies. So advantages: they can capture the interaction and the dynamic behavior among the complex systems, and then incorporate those dynamics in simulating or decision making for some complex systems like healthcare systems. And they can, because they could capture the dynamic behavior of the system, then they are capable of forecasting when the system fails, when the system is thriving, and when should you apply different scenarios. So, and also they are capable of providing decision-making at individual level, which could be patients. And they can evaluate different scenarios, various scenarios. Once you have done the simulation, then you can check if you change the current system, which is being simulated, what will happen. If you wanted to change, apply an intervention in case of the healthcare system. So if you wanted to improve the hospitals based on their capacity, based on what they can do, or you wanted to implement a different reimbursement level for different specific treatment in a system, what will happen? It can help to improve the intended goals in a healthcare system, such as early diagnosis, faster treatment, more survival for patients, and also lowering the cost. So here we talked about simulation technique. I just introduced three main simulation technique that has been used frequently in different areas, such as healthcare. So first one is a discrete event simulation, which is mostly based on queuing processes. So they try to find out how different elements in the system can respond to the demand, and how much resources we need to spend on if we wanted to meet some of the demands or satisfy the customer or patient's satisfaction. And the main elements in DES are events happening, and that are what the entities are in these events, what attribute they have, and what how much source they need. And so these are DES, discrete event simulation, is useful for analyzing effect on health outcomes and also capturing the changing attributes on entities. So if you apply intervention, what will happen to the number of demands? Can your current system with the same capacity meet the demand or not? So one example would be decision making for investing in an expansion of ICU, specific hospital, and based on variable patient flow. So you try to find or simulate the patient flow in a system, and then finding out if you expand the ICU, it would help to again respond to increasing demand, which result in a higher patient flow or not. So one simple example of how a DS system works or can be modeled is like this. Second one is agent-based modeling, which is trying to, again, capturing or simulating the dynamic behavior within the system, but mostly based on agents, which agents are the autonomous and interactive objects. It means it try to do the modeling at the individual level. So for example, each patient in a country in your system is an agent, and they try to capture the behavior or interaction of the agents, and also the interaction of the whole agents with the environment, which could be hospitals, government, or other elements or in the system. And you can see agents can be also divided in different levels, so, and can do different behaviors. For example, like individual behavior in pandemic. So if a person in a society wear mask, do the vaccination, isolate themselves, or not doing anything to reduce the pandemic. So you do the modeling of the pandemic based on the behavior of each individual in that system. Next simulation technique that I'm talking about, that I will explain more in future slides, is system dynamics. System dynamics is trying again finding the understanding the complexity of the systems based on circular causality, which means not necessarily finding a causal relationship between an independent variable and the dependent one, the response variable. Now, it also assumes that sometimes response variable can have a causal relationship with the independent one. So it tries to capture higher dynamic, higher complexity, and higher nonlinear behavior in a system. What does it mean, the system, which is a collection of parts or elements that work together to accomplish a goal. So they can interact with each other in a nonlinear way. So, and system dynamics try to capture this dynamic behavior over time, and also consider the delays, which is quite one of aspect or advantages of the system dynamic. And system dynamic uses this modeling through two tools. One called causal loop diagrams, and also stock and flow structures that I will explain more later. I didn't bring a figure for system dynamics because I will bring it later on. So just a rough comparison between these three techniques. DES and ABM, which is discrete event simulation, and also agent-based modeling, quite in a two side of the spectrum, quite opposite to each other. And system dynamics it's in between. It has similarity with DES and similarity with agent-based, and also it's different from both of them. But the main thing in DES, you are looking out in a top-down modeling, which you look at the whole system as one, and then try to break down into more lower level as events and do the modeling. But in agent-based modeling, modeling comes from bottom to up. So as we said, we are looking at each agent, each individual, their interaction, and then try to model the whole system. And DES is more passive entities. So actually something that been happened in the past, we try to, based on the data collected, we do the modeling. In agent-based modeling, we have active entities because those agents are active, they do some decision making by themselves. So we are focusing on what they do actively. System dynamics is something in between. And discrete event simulation is more based on queue, more concerned about what happened if intervention happening, what happened to the flow of the patients or flow of the entities. But agent-based is not necessarily working on the queue theory, and also system dynamics as well is looking at the time, looking at the something like queue, but mostly focuses on delays happening in the system. And time in both DES and ABM is discrete, but in system dynamics is continuous. And another thing which is important in DES is quite heavily related to data. So the inputs are mostly objective. So they have to collect data and do the estimation of the parameters. But on the other hand, in agent-based modeling, mostly the relationship or interaction between agents are defined as a rule as subjective inputs. In system dynamic, we can have both. So we normally, we can estimate some parameters based on data. Also, we can incorporate subjective rules into system dynamic modeling. Okay, so let's talk about system dynamic. So I start with a simple example of system dynamic for a simple example that you find out what's happening, what are those causal loops, what are those circular causal relationship. So assume that we have three entity elements in our system. We are going to model the population, and two main elements influence or two main factors influence population are birth and death. So we have three elements: birth, population, and death. So we know birth influence population, as have more birth, more population, and also death influence the population. So have more death, less population will remain. So in system dynamic, and this is what's called causal loop diagram. So we know that birth has a relationship with population, and their relationship is positive. So as birth increase, population increase, but the relationship between death and population is negative. So far, we've just found out death has a causal relationship with population, and birth has the same with population. But we know that there is other type of relationship, which is population influence birth, because we have more population, more parents, so more parents, more births. So, and also this relationship is positive as well. So you can see we have a causal loop. It's a circular causal relationship, not just one directed, single direction. And similarly for death, so more population, we might have more deaths, and sometimes we can, if we look at some other factors like more population, less resources for people, so maybe we have more deaths. And the relationship is positive as well, so population increases, death increases. Some other definitions in system dynamics, we can define or identify different loops. So we can have reinforcing loops, like what happened here. All relationships are positive. So these two elements, birth and population, reinforce each other in a within the reinforcing loop. And or we can have a balancing loop, which means there is a negative relationship here, you can see, and that makes a balance. So population and death relationship is balancing. So try, as population increasing, death try to balance the population. We can have some other, these main factors, we can have some auxiliary factor that you wanted to define in your system. So like death rate and birth rate that influence the birth and death, and then eventually influence the population. And you can expand your system or your modeling by adding some other factors if you want. It depends on how do you define your system. So we talked about that two tools in system dynamic, one causal loop diagram, which is here, and stock and flow. So you can see this stock and flow diagram, which is actually the main tool that do the simulation and decision making and scenario evaluation for us in system dynamic. And it's quite equivalent what's happening here. So you can see population here as a stock, and we have two flow as birth and death. So they can create a flow of population in our system. And these are the circular relationship of population on those flows that we are simulating using a stock and flow diagram. And also, if you want, you can add also those auxiliary function factors. And system dynamics works based on differential equations. So the mathematical formulation behind the system dynamic is a differential equation that try to simulate or formulate that dynamic behavior. So you can see the change of population over time can be defined based on death rate, population, birth rate, and population. Okay, so we have seen this example here, and I just wanted to quite reiterate the what's happening in a system dynamics. So understanding system complexity, we capture nonlinearity using feedback processes. Dynamic behavior over time is modeled. We can also consider delays as some of the auxiliary functions. And also we can consider capacity in system dynamics. So it's another advantage. If you want to have a restricted resources, you can model it using system dynamics. So for example, population cannot increase. There is a threshold for that one. So you can incorporate it if there is something. So if your stock has a limitation to growth or shrink, so you can incorporate it in your modeling. And again, we have stock and flow diagram and also causal loop diagram. And just there are three main behaviors that can be captured by system dynamics. They are not just limited to this one, but these are three main or important trends that can happen in system dynamics. This one is, you can see there is a growth exponentially. So it's quite related to the reinforcing loop. So because they are reinforcing each other, and they are the two factors. The stock is increasing exponentially because there is no balancing part there. But here you can see a damping trend, which is caused by the balancing loop. So there are two factors. One, for example, reinforcing, one trying to balance it. So they, after a while, after a time that passed by, the system those two factors damp each other and try to come up with some balance level. This one is quite called goal seeking, or actually mostly it happens if you have a limitation or restricted capacity for your stock. So the stock grows up to the level of the threshold that then stop there. So these all can be modeled by system dynamics. Let's have an example about how we can use system dynamics in modeling pandemic. And we are looking at one specific type of pandemic modeling, which called SIR, which we have susceptible people, infected patients or infected people, and recovered ones. And we are going to use system dynamics to model if we have different these three elements in our model to model the pandemic. So each of these elements are stuck in our pandemic modeling, because we wanted to see how much we have a population that hasn't been infected by the disease. Could be COVID. It's a bit different from COVID because here we just assume that we have susceptible, infected, and recovered. But in COVID, might sometimes recovered people can be susceptible. So it's a simple type of pandemic for diseases that can, if people is infected and recovered, they are immune. But you can see there are so many different modeling, different techniques other than system dynamics being used to do the simulation for COVID as well in pass through this couple of years. So we have the susceptible, that patient can go with the infection rate, can be infected, and again those infected people can be recovered with a rate or flow as recovered ones. We know that this number of susceptible people can influence the infection rate. Similarly, infected people and total population, other factors can influence those rates. And we tried our best to find out those elements and try to find the relationship within the system. And then we can do the formulation for the system. But the advantage of the system dynamic using their software is some of these formulations are quite built into the system. For example, if you defined an element as a stock, so this formulation is quite built in, it will be created. So you just need to find that, for example, for susceptible, we have just one flow outing from as an infected. So based on the infection rate. So it will do the calculation, the integral, everything, the differential equation by itself. So similarly here, so for infected, we have input and output flow. For recovered, we just have input flow. And then try to find and to formulate each of these auxiliary factors based on sometimes expert opinion, sometimes based on the data you collected, and based on logical understanding. So we have this model, and we will run it to see over time. For example, here is 20 days after infection happens, and what will happen to our different elements as a stock, so which are susceptible, infected, and recovered. So you can see the susceptible mostly are susceptible at the first because just pandemic breakdown, and then after a while they're getting infected. And for example, it might come after 20 days based on this formulation. After 20 days, all of the susceptible people being infected, and also based on the rate of their recovery, they can be recovered, but not all of them. Some of still are infected in the system. And also you can see what happened to the infection rate and recovery rate over time. That can help you in decision making. Firstly, we just done here a simulation of the current situation. So we don't do anything, but we are interested to see if we do some intervention, what will happen. What are the interventions in, for example, pandemic, vaccination, and quarantine. So we have two strategies to implement that will influence the normal model. So we try to find out. So if we do vaccination, people are susceptible or get recovered. Again, it's different from COVID because sometimes in COVID, if you vaccinated, not recovered or immune completely. But yeah, we assume that susceptible people get vaccination and they go directly to recover. But quarantine is for people that get infected. So we try to make them, put them in recovery and then in a quarantine, and then they get recovered. So they tried this situation, they tried to reduce the infection rate. So people being here, because you can see the infected people can influence the infection rate. So when you put them in a quarantine, so the number of infected people in the society is reducing. Then because why we do that? Because we are going to find out what should we do. We should do quarantine, vaccination together, both of them or none of them. So in here again, you can run the model again with the vaccination, quarantine, or none of them happening, both happening, or one of them happening. So you can see that we have, if we are looking at if the infected people is the stock of interest for us, we can see for example, vaccination, if none of this happening, which is the base model, so you have so many infected people. If you just apply quarantine, again, based on the parameters you estimated, you can help, but not much. If you apply vaccination, so you quite the number of infected people reduces, and because so many of the susceptible are not going to be infected anymore. And if you apply both, it is the best one. So if you're just looking at the infection, you can decide to do both strategies, but you might have some other criteria as a cost, because both of these interventions have cost. So you can also incorporate cost in your modeling and then decide based on what happened to cost, what happened to the infection, and then decide what would be the best strategy. And sometimes we need to disaggregate our stocks because, for example, infection rate is different for young people, middle-aged people, and elderly people. So you can break down your system modeling into 3 different levels of young people, adults, which means middle-aged, and then elderly people. So it is possible to you do this, consider different cohort of patients, cohort of people in your modeling. So just again, summary, the advantage of the system dynamic, which is a top-down structure. So you consider the whole system and then try to break it down into individuals or lower level entities. You can evaluate the strategic policies. You can use mental models, which means what's in the mind of the experts. So you can, if you don't have enough data, you can incorporate expert opinion in your modeling. You can have visual models, so easily you can explain it to someone so it's interpretable. So you can see what's the relationship between elements that make the whole system makes those outcomes. It's almost easy to model, so you can model it visually. Low computational complexity, and you can see you have the facility to model alteration, which provide the opportunity to do intervention modeling or evaluating intervention or some different scenarios. Here I just explained one recent case study that I've been working on in genomic testing. So just overview of what's happening. We've been dealing with this situation that we are going to implement genomic testing for cancer diagnosis. So that's okay. So we know that we need to do some genetic testing or biomarker testing to diagnose the mutation in the genes and then find out that patient has cancer or not, or cancerous cells in the biopsy or not. So that's the quite standard of care happening. But there are some other techniques called, so in biomarker, normally every time just one gene or one mutation is tested to find out. So sometimes in a first biomarker testing, the cancer can be diagnosed, but sometimes no, it should go in a sequence of some different several tests and then come up with a diagnosis. And also, but there are some other techniques called whole genomic sequencing that they can do the all of the sequences or checking all the mutation at once at one test. So, but there are some problems, limitations. First, they are costly, and secondly, there are not much facility for them to apply currently. So just a specific hospitals, for example, in this case, we have general hospitals and academic hospitals, and just WGS happening in academic hospitals, and we have some teaching hospitals as well. So current procedure is patient go to general hospital, do some testing. If not diagnosed, go to teaching hospitals, and then go to academic hospitals. If not still diagnosed, and then there is a possibility to do the whole genomic sequencing. Not necessarily for all people it happens, but there is a situation that they can do that. And so then it goes, if the biopsy of the WGS happening, whole genomic sequencing happening, then goes to extract the data and do the diagnosis. So we try to, so you can see this flow of the patients toward each of these different hospitals in different situations, in different locations. So to address this problem using system dynamic, we try to first create the causal loop diagram. So we have the general hospital, teaching hospital, and academic hospital. And these referrals also are elements in our system because they cause delay in the diagnosis as well. So patients come to each of these randomly based on the proximity to each hospital. And then you can see these are the referral from general to teaching to academic. And then in academic, there is a chance to WGS, but not necessarily all get the WGS testing. And then it might sometimes WGS fail and it goes back again to the standard of care. And if it didn't fail, it goes to facilities and then come up with diagnosis. We created a stack and flow diagram for this one. So you can see it is more complicated because it's dealing with more complicated cases. And then I just wanted to explain one intervention that we wanted to see if we refer patients in a general hospital directly to academic hospital, what will happen. So we have just one intervention, one alteration in the model, and check these two scenarios. Scenario one is what happened currently. Scenario two is if we refer patients directly to academic hospitals, and then there is a chance for WGS. So you can see the time for diagnosis is reduced. Actually, the number of the diagnosed patients is increased in scenario two, but the cost, because of the cost, it's still costly. But you can see this, then you have a double of diagnosis for patients. So you have the diagnosis time for patients, but the cost is not necessarily doubled. So it depends again based on, you can look at some other factors or availability of the budget. It seems WGS is reasonable to be applied to reduce the diagnosis time. Yeah, that's my presentation. Thank you so much.
Thank you, Dr. Hadi, for the wonderful presentation. Can see there's a question in the chat box. If we are using the SD method to model diseases, can we include the feedback processes into the model such that we can use the model to improve the performance of the healthcare system to address COVID-19 through feedback?
Yeah, actually the main advantage of the system dynamic is you can look at the feedback loops as well. So not necessarily traditional conventional statistical model that try to find the causal loop between independent and the response. It's try to look at the causal feedback of response or causal feedback among different or interaction among different elements in the system. So yes, it can be applied. And I think that there might be some research, I haven't seen, but some research that try to address COVID-19 pandemic modeling using system dynamic in the literature. You can find it somewhere. But yeah, the answer is yes.
Please feel free to ask any questions. You can pop your questions into the chat box if you have any.
Mm-hmm.
Hadi,
yeah,
it's Tan. I was just wondering if you can provide an example or even show us an example of an output that you might get from the modeling. I just wanted to have a flavor of the outputs that you would see.
Sure. So actually, yeah, these two diagrams are the outcome got from our recent modeling. So I told you that we had two scenarios. Scenario one was what's happening currently in terms of WGS implementation, and scenario two was we assume that if we cut the corner and send patients from general hospital to academic, what will happen? And we have two concern or two criteria to measurement that is important for us. One, total cost, that you can see I put it here by summing different costs happening throughout the system, and also diagnosed patient, the number of diagnosed patients. Again, summing it, some of it, because we have different flow and diagnosis happen at different levels. So I do the summation here, and these two are our main measurement being interesting for us. So we run the model in under different two situations. So we have the alteration here. We can switch between scenario one and scenario two using one factor that I put here. Yeah, refer, not here. Yeah, scenario. So I put a trigger or quite switch in here as a scenario. So if scenario is one, so it goes as a normal simulation, current simulation. If it's two, it goes from it changed to the scenario two and run the model based on assumption of the scenario two. So then the model can give you outcome for each of these scenarios over time. Here we had, for example, 400, more than 300 days. It's been run. It hasn't been run for 300 days. It's just a quick, but it's a run simulated model for 300 days to see what would be the total cost, what would be the number of diagnosed patients. And again, in that example I gave you about the pandemic, you can have the same situation here. So when we model this pandemic like this, we have 4 different scenarios we can test. One, simple, the current model like this happening, nothing happened, there's no intervention, nothing. It seems we left the pandemic to go as by itself, or we can apply vaccination, quarantine, or both together. So we have 4 different scenarios that the model can run under each of these scenarios and give us the outcome like this. So if your outcome of interest is the infected patients and the number of infected patients, so you can do the comparison based on this model. You can see. So this also is outcome of the software in system dynamic.
Is there a function to do an ISA? I'm assuming there would be a possibility to run an incremental cost effective measures comparing one intervention against the other.
Can you explain it more? What do you mean with that one?
Yeah,
you mean the cost, or
I guess the incremental cost and benefit over the incremental benefit. So yeah, so just sort of to see, obviously there's different, for example, this one here, you can see 4 different scenarios. You know, is it possible to the current program? I think a question in the chat was asking what program we used. I guess the ability to run an incremental cost effectiveness ratio calculation without having to, for example, manually do it within another program, for example.
Yeah. Yes, there are different functions that you can adopt based on your data, based on your assumption in this system dynamic model. So you can assume that it's just a fixed cost. It's easy one, but you know, you see there is a different level of cost happening based on different demand, different level of the stock. So yeah, you can define it. So there is a piecewise or incremental type of functions in a system. And also you can assume everything happening at random as an input in the system. For example, patients come at random, but no, you can say no. You can say that no, it's the input patients are based on, for example, different type of distribution, viable distribution, whatever happening. So there is an opportunity you implement those different probability distribution in the system and then run your system based on that assumption. So yeah, it is possible. So I can see that there are other. Did I answer your question, Tan?
Yeah. What program do you use? I was just curious.
Yeah, I explain because there is a question here. So I answer this question first and then go for the other question. There are a couple of softwares in system dynamic. This one, and you can see if I show you here, I have a stock flow in a colorful model, but here is different one. So these are different softwares. This one called iSync, which for MIT University, developed by MIT University. And this one called Vensim, which is quite the most popular software for system dynamic. And the good thing about Vensim is it's freely available for academic use, not for commercial, but for academic use. For a student, for academic research is freely available. So it's called Vensim. Let me write it down here. So Vensim, iSync. And also, if you work with R, there are packages that can implement system dynamic in R, especially those packages that can solve differential equations. So because system dynamic working based on differential equation, so you can, if you're familiar or comfortable using R, so you can use R and maybe you can come up with some more fancy visualization at the end. But the problem is you cannot do this causal loop diagram and this stock flow visually in the R. You can develop the model based on stock flow, but it's like a code. You cannot have those visuals. And also, if you are interested to do system dynamic in R, I recommend looking at this reference, System Dynamics Modeling with R, which is very good in explaining system dynamics and very good with lots of examples that I also brought one example from that book in my presentation to how you implement system dynamics using R. Another question was about WGS. So the question is, do you think WGS high costs are a major challenge for adoption? Yes, right now it is because it's quite new and my current project is also in genomic testing and also something about large panels of biomarker testing, whole genomic testing, sequencing, or next generation of sequencing. They are effective, but they are costly. And the question here is, if we need a whole genomic sequencing to be implemented very early or still using those standard of care using individual biomarker testing are enough based on the number of patients can be also diagnosed using the conventional biomarker testing. So right now, that's the question that also the government and also insurances are seeking to find out, should they allocate some reimbursement for whole genomic sequencing if they are effective enough and they can also reduce the diagnosis time, improve the survival, and also maybe in general they can minimize the cost, the whole cost of treatment. But yeah, for something is challenging right now, mostly is about cost, and it's not just cost of the conducting WGS, cost of providing facilities for that. So there are some specific facilities that should be established that is quite impeding applying WGS at this time. Yeah. Any other question? Okay, it seems no question right now.
I have a question. Sorry, Dr. Hadi, can I ask, do you have any recommended packages that can be used in R for system dynamics modeling?
Yeah, as I said, if you look at this book that I mentioned here, system, I can write it down as well for someone if you wanted to. This book has recommend or as also works based on that package. The package is called Dissolve, which is differential equation solving. So this is the package they use for in R to implement system dynamic. So yeah, you define the system, define the variables, and then when you run the model, it's been solved by Dissolve package, which is solve the differential equations.
Okay, thank you.
You're welcome. So,
is there any other questions? We have time for probably one more question.
so I think I can stop sharing. Okay. And thank you for everyone being as audience, and I hope it was informative for you. And yeah, thanks for inviting me for this presentation.
Okay, so thank you, Dr. Hadi, for your wonderful presentation. We are correct for this session, and thank you to all attendees for your participation. At the end of today's symposium, we'll be sending out an evaluation form, and we'll greatly appreciate if you fill out this form. So now we have a short break and return at 3 p.m. for our interactive workshop session. Thank you.
Thank you.
Hi, Anne, are you there?
Yeah.
Hey, I was just wondering whether I'll be chairing the next session, I believe. So I was just wondering whether you need me to, whether you need to transfer host rights to me, or it's okay without.
Can you say again? Because it was a little bit noisy.
I just wanted to ask if whether you need to transfer host rights to me as chair for the next session, or if it's not needed.
Sure, yeah, yeah, I can make you a co-host.
Yeah,
So, yeah.
and I'll just keep I'll keep my light on as well, just so that I can
Yeah.
monitor it to 3.
I should stop recording.